we conducted a systematic review of the computing and HCI literature to provide a comprehensive overview of the current state-of-the-art of machine learning work for mental health. Searching the ACM Guide to the Computing Literature, we follow PRISMA review guidelines to identify 54 papers that report an application of machine learning in the context of mental health. Our review process was guided by the 6 questions shown here, with the aim to extract current trends and gaps in research and development in this important and emerging space. Amongst our findings, we saw an increase in the number of publications in recent years, with a vast majority of papers describing the development of a machine learning model as their main contribution. Very few papers report on empirical studies, for example, of an end-to-end machine learning intervention. In terms of types of application area, almost all papers focus on supporting understanding, detection, and diagnosis of mental health status. Here, most common examples include the analysis of acoustic features of speech or of Twitter tweets to help detect or diagnose symptoms of depression or risks of suicide. In fact, as we can see here, sensor data, especially from mobile phone interactions, and text data, primarily from social media, were the most commonly used data sources for machine learning analysis. Aside of efforts to understand, detect, or diagnose mental health status, few work sought to improve mental health treatment or assess patient-client relationships. But why are we seeing such a dominant focus on mental health problem detection and diagnosis? Reflecting on this question, we ask ourselves how problem scenarios for machine learning are commonly identified. We can assume that the need for access to large-scale data moderates the types of machine learning applications that are being developed. In fact, in most studies, uses of data that actually represents patients or people with a diagnosed mental health condition is often low in numbers, with exceptions where the analysis includes health records or research collaborations involving large health organizations. Plus, for health detection and diagnosis, outcome measures are more commonly and clearly defined, for example through clinically validated scales and screening questionnaires. Thus, we suspect that general difficulties to collect and access high-quality mental health data can limit study design and force researchers to use readily available data that may be suboptimal for exploring a particular research question outside of the original data context. We believe it is important, however, to not be limited by data access restrictions and instead to ask, what are the most beneficial rather than perhaps the most obvious applications of machine learning? To identify other, perhaps even more beneficial uses of machine learning for mental health requires the identification of key healthcare needs through a deeper engagement by researchers with the real problems that are faced by potential users and healthcare services on a day-to-day basis. Also needed are better approaches to negotiating data access by ensuring that people generally agree to and can trust researchers and data applications for the collection and processing of their sensitive information. Taking these steps towards more multidisciplinary work and improved data access can help broaden the scope of opportunities for machine learning and its possible impact beyond mental health detection or categorical diagnosis. This may include, for example, uses of machine learning to more effectively tailor mental health interventions, for treatment optimization, preventative approaches, and many more. Our analysis further showed that the majority of papers focus on the technical or algorithmic development of initial machine learning models and most commonly assess their effectiveness through model performance metrics. While many of the works speculate about the potential impact on clinical and everyday mental health practices, we caution to not prematurely overclaim anticipated clinical benefits or generalize too soon from initial proof of concepts, especially where the data did not include much or any clinically validated data. For future work, there's also a need to study and assess the practical usefulness, acceptance, and effectiveness of developed models for real-world healthcare practice. Likely, this requires an extended focus on the challenges of designing new machine learning-enabled systems that are sufficiently interpretable and clinically useful to its target users or recipients, and for research and development efforts to also recognize and carefully respond to many of the broader practical and ethical implications that the use of machine learning systems could have for people, healthcare, and society.